Tinea unguiculum, or onychomyosis, is a fungal infection of the toenails and fingernails. It lives in the nail bed and in the nail plate, and this provides an extremely well-protected place for the fungus to live, which is why the fungus may be especially difficult to treat. The primary sign of nail fungus includes the appearance of a nail that can turn yellow or apricot. The texture also changes, and the nail becomes thick and brown. If it's been present for a long time, the nail can become twisted or distorted. The most effective treatment includes the oral terbiphene hydrochloride and others. The drug must be taken for 6 weeks for fungal infection of the fingernail and 12 weeks for the infection of a toenail. Here are some of the pictures of the most common fungal infections. Viral infections. Warts. Warts or verrucous are caused by human papillomavirus or HPV. This results in hyperplasia of the epidermis and a raised cauliflower-like appearance. The most common sites are the fingers and the soles, and the most warts resolve over time, but they can be treated with topical chemicals, excised surgically, vaporized with lasers, or removed with cryosurgery. Herpes simplex, or cold sores, are fever blisters, and they can be caused by the herpes simplex virus type 1. The initial infections may be asymptomatic or cause painful ulcers along the gum lines of the mouth or on the lips. After the primary infection, the virus remains dormant in the trigeminal nerve and can be reactivated by the exposure to the sun or cold, presence of another infection, or when the patient is under stress. The symptoms include burning, tingling, or the numbness before the eruption of vessels. Blisters typically heal in 2 to 3 weeks, but you can speed it up by the use of topical antiviral drugs like these below. Or you can use antiviral drugs, including Fenvir or Valtrex. Herpes zoster or shingles. This is an acute inflammatory disorder characterized by highly painful vesicular eruptions on the trunk of the body, which is the abdomen, and sometimes the face. These lesions develop on one side of the body and follow the course of the peripheral nerve, or the dermatome, that has been affected by the varicella virus, the same exact virus that causes chickenpox. This virus lies dormant in the dorsal root ganglia and is reactivated in later years. Take note, the cause of this reactivation is unclear, although it appears to be related to stress, immune system problems, and aging. The onset of this disorder is marked by the pain, and lesions appear approximately 3 days. The inflammation lasts 10 days to 5 weeks, and symptoms can be like complaints of burning or tingling, pain or numbness, or itching on one side of the body. The most common location for shingles is on the trunk or around the waistline, and it can also occur on the forehead, the cheek, the nose, and around one eye, which can threaten the vision. Besides the rash and pain, it is also diagnosed by the virus in the cell cultures and the presence of varicella zoster antibodies in the blood. Treatment includes analgesic and antipyretic medications, corticosteroid medications, and antiviral drugs can be prescribed. Antiviral meds help shorten the length and severity of the shingles outbreak, but must be started ASAP as soon as possible after the rash appears to be most effective. One of the most serious complications of shingles is the post-herpetic neuralgia. This causes chronic pain after the resolution of the initial outbreak. It may require treatment with a combination of medications, including lidocaine, skin patches, narcotics, antidepressants like Cymbalta, and the anticonvulsant gabapentin. Shingles vaccine, or vaccines to prevent shingles, includes chickenpox, the varicella virus, that can be given to babies 12 to 18 months old, and to older children and adults who have not had chickenpox. This vaccine reduces the risk and severity of both chickenpox and shingles. The herpes zoster vaccine is recommended for adults 60 years or older, regardless of whether they have had shingles. This does not guarantee protection against shingles, unfortunately, but it can reduce the duration and severity of the outbreak, and it helps prevent postherpetic neuralgia. Parasites. The two most common parasites are the itch mite, which causes scabies, and lice, which cause tuberculosis, and they are both highly contagious. Scabies mites are tiny organisms that burrow into the epidermis. The diagnosis may require scraping of the skin of the inflamed area, or something of that nature. The symptoms include intense itching, like a possible body rash, and a sensation of something crawling on the skin. Usually there is no symptoms the first 2 to 6 weeks of the scabies infestation, but that doesn't mean nobody can get it. The treatment includes ridding the body of the parasite, controlling the pruritus, which is the itching, and disinfecting the home environment to prevent reinfestation. They recommend this for all household members in sexual contact in the past month. They all should be treated at the same time to prevent reinfestation. No OTC products have been approved for the treatment, so they must get a prescription. Treated with a single application of 5% Elimite or Erax creams all over the body from the neck down. It typically is applied before bedtime. It should be left on for a minimum of 8 hours. It can be repeated in 7 to 10 days to destroy the nits or the eggs. Quell is no longer recommended because of the widespread resistance and the potential of severe neurological side effects. Pediochlosis, which is the infestation with the lice, can be caused by 3 different types: head lice, body lice, or pediochlosis lice. Here are some of the CDC recommendations for treating lice. Applying lice medicated shampoo, like Nix or Opti. Do not rewash the hair for 1 to 2 days after the treatment. Check the hair and use a nit comb to remove nits and lice every 2 to 3 days. Continue to check for 2 to 3 weeks to make sure all lice and nits are gone. Head lice survive less than 1 to 2 days, and nits die within a week if they're not on the person. Machine wash in hot water and dry on high heat, which is like all the clothing, the bed linen, or the other items worn, for 2 days before the treatment. Things like that. Inflammatory skin disorders. Seborrheic dermatitis is one of the most common chronic inflammatory conditions of the sebaceous glands. It alters the amount and quality of the sebum, resulting in dry or moist, greasy appearing scales and yellowish crust on the scalp, eyebrows, eyelids, and sides of the nose, behind the ears, and the middle of the chest. Different forms include the cradle cap in infants, dandruff in adults. It can be treated by tar or sulfur-based shampoos, Inflammation of the skin usually are treated with topical corticosteroids such as generic triamcinolone diacetate or fluorouracil acetonide. Seborrheic keratosis, or age-spot, is characterized by the benign, slightly raised tan to black lesions that can occur with aging. Contact dermatitis is an acute inflammatory response to skin irritant or from exposure to a substance that can cause allergic reactions. Like especially individuals allergic to latex gloves or have been exposed to poison ivy. They can show signs and symptoms of redness, edema, pruritus, and vesicles. These patients should be encouraged to wash the affected area immediately after the exposure. Treatment can include application of a corticosteroid cream or the use of an oral corticosteroid medication like prednisone, Medrol, if the symptoms are severe. Eczema. Eczema is an idiopathic inflammatory skin disease that can occur in patients with a family history of allergies. It can be caused in young children by food allergies, older children from stress or temperature extremes that can trigger flare-ups. This condition usually improves and may disappear as the child ages. It's characterized by vesicular rash on the face, neck, and elbows, and behind the knees and the ears. It causes pronounced pruritus that, if left untreated, results in expiration of the affected area from constant scratching. Thank goodness it is not contagious. It is diagnosed with a comprehensive family history and the examination of the skin. The goal of the treatment is to reduce the frequency and the number of eruptions and to relieve the pruritus so the affected areas will not become exacerbated. Primary inflammation can be treated with topical corticosteroids and oral antihistamines to control the itching, like Benadryl. The provider may recommend controlled exposure to sunlight to prevent and treat outbreaks. Psoralen are light-sensitive drugs that absorb UVA light and are combined with the UVA light to treat the skin conditions eczema and psoriasis. Inflammation of eczema plaques typically indicates a secondary staphylococcal infection and should be treated with an oral antibiotic. Autoimmune disorders. Psoriasis is a chronic skin disease that produces discrete pink or red lesions covered with fibrous scale. Most of these patients develop the problem before age 40, and it's not infectious, but it is characterized by periodic flare-ups throughout the life. It is caused by autoimmune reaction that speeds up the maturation rate of skin cells. You see, normal skin cells mature, die, and are shed every 28 to 30 days. But with psoriasis, the cells mature in 3 to 6 days. And instead of coming off of the surface of the skin, they build up and form the psoriasis patch. And the skin is dry, cracked, and encrusted. And the lesions can appear on the scalp, chest, buttocks, and the extremities. Outbreaks of the psoriasis plaques can be associated with triggers like infections, injury to the skin, or bug bite, stress, cold weather, smoking, and heavy alcohol consumption, and certain medications like lithium for mood disorders or beta blockers for hypertension. It can be diagnosed by the observation of the skin, a careful patient history because a familial link has been established, and a skin biopsy. Treatment is palliative because the disease has no cure. You could do exposure to UV light because it slows cell production, and a cold tar preparations because it helps irritation when applied to affected areas.